The typical age of a patient in the United States treated for CLL is about 74 years old. That's the median age. Of course, there's a broad diversity, and there are patients who are both younger and older. And, the younger a patient is and the more aggressive their disease is, the more likely they are going to have a relapse. We know that for many patients, they will cycle through more than one therapy. So it's not just going to be a BTK inhibitor alone. They may need a BTK, they may eventually need a BCL2. And that's where this pirtobrutinib, which is sort of a third generation BTK inhibitor, the first non-covalent, and I'm sure we'll get into that, non-covalent inhibitor may play a role. And that's what this study was designed to address. First and second generation BTK inhibitors, and for the audience, that's essentially ibrutinib, acalabrutinib, and zanubrutinib. Those are all what we call covalent inhibitors. They actually form a chemical bond to the BTK enzyme, and that's because deep within the binding pocket of the molecule, there's a cysteine residue, and that cysteine residue is very reactive. And so the drugs don't actually necessarily stay in the body a super long time, but during the time that they are in the body, they bind irreversibly to the BTK enzyme, and that molecule can't come off. And so the most common way that people get resistant to a BTK, first or second generation BTK inhibitor, is that they mutate that cysteine to a serine, and then suddenly ibrutinib, acalabrutinib, and zanubrutinib can no longer bind to the enzyme. There are other mutations that can block that as well. That's perhaps the most common. And pirtobrutinib is different. Instead of binding to the molecule, it's that the molecular shape of it is very specific to the binding pocket, if you will, for the BTK enzyme. So instead of forming a irreversible bond, what it does is just it fits in there so well. The other thing that's a major difference is pirtobrutinib gets into the body and stays at a concentration throughout the 24-hour period um, where it remains available to continue inhibiting the BTK enzyme. So the key distinguishing feature is that for those patients who develop resistance to a first or second generation BTK inhibitor, oftentimes they remain sensitive to a third generation BTK inhibitor such as pirtobrutinib.